name's Anna. I'm a UNLV nursing student. I'm here to do a real quick history assessment. Can I please have your first and last name, date of birth?
Sunday Martinez, 120804.
Okay, thank you. I'm going to ask 4 quick questions. Who are you? Where are you? Who's the president? And what day is it today?
London, my name is London. I'm in my home with President Trump, and Saturday.
Alright, thank you. Patient is alert, awake, and oriented times 4. His speech is clear and coherent. He looks well nourished and clean. And his expression is calm and relaxed. I'm going to have you stand up real quick. I'm going to have you walk straight, tippy toe, heel, and then heel the toe, heel the toe, heel the toe, heel the toe. Patient's gait and general movements is smooth, steady, rhythmic, and coordinated. And I'm going to test for his light touch sensation. I'm going to have you stand up real quick. Close your eyes. When you feel it, say no.
No. No. No. No. No. No. No.
Okay, thank you. Light touch sensation in upper and lower extremities is intact by lot. I'm going to do the creak here real quick. I'm going to say 3 random mix of letters and numbers. You just repeat after me.
Take 1X. B17.
Patient period. By a lot. I'm going to do his facial symmetry. I'm going to have you smile, frown, put your cheeks out, and then eyebrows up. Yep. And then relax. Facial symmetry is symmetric, moves symmetrically with expression, no lid lag, no drooping. I like. I'm going to do the pupils. I'm going to look. Pupils. Yeah. Oh, I'm going to do the active to light test. This. Okay. I'm going to have you look behind me, and I'm going to introduce an object. Look at it. Pupil size is 3 millimeters, equal and round. Reactive to light, direct and consensual with accommodation by light. And now we're going to do your cardiovascular. Skin is consistent with ethnic background, no lesions, no bumps visible. I'm going to be doing 5 precordial sides and the apical pulse. Apical pulse, I'm going to be counting for 60 seconds. But the precordial sides, I have 5. Aortic is second intercostal space. The right sternal border and left sternal border is the pulmonary second intercostal space. Right below it, the third intercostal space, left sternal border is the Erb's point. Below Erb's point, in the same fourth intercostal space, left sternal border is tricuspid. Mitral is fifth intercostal space, midclavicular line, and lateral to that is the apical. Now I'm going to be listening with the bell or the diaphragm first, and then the bell. Bell. Precordial sides and the apical pulse, regular rate and rhythm, only S1 and S2, no S3 or S4, no valid, no murmurs, no breweries, no wishing. And now I'm going to be doing the respiratory, no, let's do peripheral vascular. I'm going to have you stand up real quick. I'm going to be palpating the upper extremities, lower extremities, as I'm down here. I'm going to be checking for pretibial edema. No pretibial edema in the lower extremities by a lot. And then I'm going to have to sit down, please. And check for the cap refill. 1, 2. Cap refill is less than 2 seconds in the lower and upper extremities by a lot. Upper and lower extremities, skin is warm and dry, consistent with ethnic background, no lumps, bumps, masses, deformities, abnormalities, and tenderness and swelling. I'm going to do the radial pulse, 60 seconds. The same with the pedal pulse, 60 seconds. Radial and pedal pulse is 2 plus by lat. No bounding. And upper and lower extremities are also symmetrical by lat. Everything is by lat. And now I'm gonna do the respiratory. So I'm gonna be checking the trachea, palpating the trachea. Go this side, this side. Trachea is midline, symmetrical, no lumps, bumps, masses, deformities, abnormalities, tenderness, swelling. I'm going to be palpating the anterior chest, do the symmetrical test. Okay. Thank you. And then close chest. Alright. Anterior and posterior chest. Skin is warm and dry, consistent with ethnic background, no lumps, bumps, masses, tenderness, deformities, abnormalities. The anterior and posterior chest are also both symmetrical, bilat. Everything is bilat. The thoracic shape, AP diameter is less than transverse diameter, ribs are downward sloping, and it is elliptical shape. And now we're going to do the respiratory first. I'm going to have them breathe for 60 seconds, and after I count their breathing for 60 seconds, respiratory rate 12 to 20, let's say it's 14, within normal range. Respiratory pattern and work of breathing is clear even in labor with no use of accessory muscles. Now I'm going to auscultate for their lung sounds. Do 5 at the anterior, 9 sides in the posterior. Back. Okay. Anterior and posterior chest lung sounds are clear with no adventitious sounds. Okay, and then we are ready to go to the gastrointestinal. So I'm going to have them assess their ability to swallow. Gonna have them open their mouth. Check for everything. Okay. Patient's ability to swallow is intact. No halitosis present. Teeth is white, clear, white, evenly spaced, clear of debris, bilat. Buccal mucosa and gums are pink and moist bilat. Tonsils are pink and moist, 1+, 2+ grade bilat. Tongue is pink and moist. Papillae, dorsal side has papillae, and ventral side is smooth with small veins. The hard palate has transverse rugae and is white, and the soft palate is pink and smooth and upwardly movable. And now we're going to do the abdomen. I'm going to have you lay back. Abdomen skin is consistent with ethnic background. Contour and shape is flat. It is symmetrical. Umbilicus is midline and inverted. I'm going to be auscultating all 4 quadrants for 5 minutes. Starting right lower quadrant, 1, 2, 3, 4. Bowel sounds are no more active in all 4 quadrants. Now I'm going to check for skin trigger, pinching the skin. Skin is well hydrated and there's no tension present. Now I'm going to be palpating. Light palpations is 1 centimeter, deep palpations is 5 centimeter, doing circular motion, starting with the right lower. Deep palpations, going to have them breathe in, big breathe in, and then out. And 5 centimeters, a little bit deeper. Light palpations and deep palpations, no bumps, lumps, tenderness, masses, deformities, abnormalities. For the light palpations, there's no tenderness, and there is superficial musculature. It is present and intact. Deep palpations, there's no organomegaly present in the masses. And then pick it up. We're going to do the range of motion. I'm going to be palpating your joints, the TMJ, cervical spine, lumbar spine, shoulders, elbows, wrists, fingers, hips, knees, ankles, toes. All of those areas, skin is warm and dry, consistent with ethnic background, no lumps, bumps, masses, tenderness, swelling, deformities, abnormalities. Then we're going to do the range of motion. So I'm going to have you do the lumbar spine first. Can you flex, extend, hyperextend, lateral flexion, rotate, rotate. I'm not going to do any resistance. I'm going to do the TMJ. Open, close. Oh no, I'll just keep it open. Side, side, protrude, back, protrude, side, side, open. Alright. You do the cervical spine, flex, extend, hyperextend, side, side, rotate, rotate, and rotate back, rotate, ah. Alright, forward. Wait, no, that was for a different one, but it's okay. Now we're gonna do the side and then side. Now we're gonna do the shoulder shrug, abduct, circumduct, adduct, flex, extend, hyperextend. Alright, okay, and then forward. Alright, wait, forward, because I'm gonna fly forward, backward, outward, inward. Alright, and then we're gonna do your elbows, flex, extend. Alright, wrist, flex, extend, hyperextend, radial deviate, ulnar deviate, circumduct, flex, extend, adduct, grip strength. Yep, one, both. Okay. Do. Index. Yep. And then resist. Yep. And I'm gonna do the hips, flex, extend, abduct, externally rotate, internally rotate. And I'm gonna imagine you did them both. Out, in. Sit down. Alright, do the same. Flex, extend, resist, and then do your ankle. Flex you down, or flex up, invert, subduct, flex, extend, abduct, resist, up, down. Okay, so we got everything. Everything from TMJ, cervical spine, lumbar spine, shoulders, elbows, wrists, fingers, hips, knees, ankles, toes, full air without 505 for the lumbar spine, because no resistance, no cracking, no crepitus, no popping. Double checking in case you forget anything. I'm still within time. Double checking. Okay.